Welcome back to a brand new episode of the Active Life Podcast, the #1 podcast probably in the world, and certainly for fitness professionals by fitness professionals. Back in the studio with Dr. Sean today. Dr. Sean, welcome back.
Thanks. You know what I was just thinking?
What's that?
So good, Larry's not here.
How long have you been waiting to drop that?
Honestly, it just hit me. I listened to a podcast he did with you recently, and at one point I was like, just shut the fuck up already. We get it, dude.
What were we talking about?
He was doing the intro. It was like, I think he was, I couldn't tell. I think it might have been a joke. But he was like, the #1 podcast in the world for who because even if, and I was like, dude, I hope this is a joke.
He's so deadpan sometimes you can't tell.
I know. I was looking at your face to try and decipher whether he was being serious or not, and I couldn't tell that either.
Very stoic. All right.
Yeah.
Well, I'm excited to have our conversation today. It's good to have you back. I'm excited. You've been doing a very intentional job, I would say, over the last few months in the events that I've been to with, the things that I've seen you go, the talks that you're giving on stage. The message has become more clear, and specifically the way that you articulate the problem, right? The problem that we solve has become so clear and so well refined. I'd love to dive into that today because I think as professionals and as coaches and trainers who listen to this podcast, they're going to be able, and even people who aren't one of those things, they're going to be able to hear something in this and be like, oh shit, that's interesting. That's inspiring. I haven't heard someone in the fitness space talk about it this way before.
I hope so.
So what's been the precipice of this change, right? And this clarity, because we used to say, get out of pain without going to the doctor or giving up the gym.
Mm-hmm. Yeah, great question. I think there's a few things here. One is, I think anyone who's been an entrepreneur, trainers, understand that there's an arc that our life takes that our business doesn't need to take with us, that I didn't realize the business didn't need to take with me as I was doing it myself. And this is so true across a variety of things in business when you're the leader. And Mike Bledsoe, our mutual friend, taught me, like, don't make the business bank account your personal bank account. When the business used to have bad months, I had bad months.
Mm-hmm.
When the business had good months, I was like, we're good. That's far from the case anymore, right? But so what happened was I was really good at helping people get out of pain. And we were really good at helping people get out of pain. And there were people who would come to me and say, I wish I could work with you guys, but nothing hurts. I'm like, you can. You can. In fact, the most valuable thing that we do for people is not get them out of pain. It's get them the life that they would want if they weren't in pain in the first place. We can help you with that. And then it got, because I was in this phase of personal development where I was like, what do I want? And I want much more than one little myopic thing, like getting out of pain, which I was in. And so it got lost in the everything else that people don't know that they want. Instead of, hey, you're in pain? Yeah, great. We can help you with that. And why, by the way, is it important that you get out of it? Oh, great. Well, I want to make sure we get you back to that. That'd be cool? Yes. People grasp that much easier. I was not seeing it as an inspiring enough problem as pain alone.
Why not?
It felt easy. I have a need for challenge of sorts. And we've helped so many people overcome chronic pain. And we've helped so many people help so many people overcome chronic pain. I was like, what else can we do? That's it. It's that simple.
I think that's a really interesting thing for people who own facilities or own their own businesses to be taking away from just this introductory piece of the conversation, because often what we'll notice, especially in the fitness space with coaches, is they go and they take this new certification. They go to the strong first. They go to the Olympic weightlifting. They go to the powerman, and then they come back, and the entire structure of their business from a programming perspective, especially if it's in a group facility, changes as a result of that. Because it's the shiny thing. It's the new thing that you're chasing after, rather than focusing on the thing that is simple to understand and easy for the client and prospective clients to be able to understand that you do really well.
Well, I think that's what CrossFit did really well for 15 years. It was, no, it's constantly varied functional movements executed at high intensity. Shut the fuck up. Do it like that. That's it. Just like that, but better.
Yeah.
They did a really good job of that for a long time. And then they got into battling big sugar and big soda, which has merit, right? But it became this like, wait, are we all supposed to be activists now? Is that what it is? Are we an activist company? Like it just, and I think you see that in a lot of companies. It's not unique to CrossFit. I just know a lot of our listeners understand the CrossFit arc because they were in it. Yeah. I went through my own, and we're back, baby.
Let's go. It's been easy to articulate as leading the flagship. It's been easy to articulate that that's the problem that we solve because people they can raise their hand for that.
Yep.
Where if it's like it's a personal development company that uses education, exercise, and mentorship to help you live a life of freedom without compromise, they're like, cool. I'm not really sure what that means, but cool.
Right.
Good for you.
It sounds great. I bet you guys do a great job with your clients.
Yeah.
Yeah, you should be one. Should I? Yeah.
Right. Okay. So we've gotten back to the core problem. The core problem is pain in the way that the person understands it. But after hearing you talk about this so many times, it's not really the pain that is the problem. What is it?
Well, it's the compromise that people have to make as a result of the pain that they're in. And what that means is they're not going on the vacation that they want to go on because they're afraid they're not going to be able to go on the hike because they're going to slow their whole family down. They're not able to play with their kid at the playground the way that they want to play with their kid at the playground because their knee hurts when they run. These kinds of things. But I was recently having a conversation with a very smart person who was like, yeah, well, I imagine people with cancer who are in the hospital would rather not be in the hospital too, right? It's not so much about the cancer for them either as it is about everything that they're afraid they're going to miss out on or are actively missing out on. And it was a really good point. And so what has been helping me now talk about pain in a way that is more clear, I think, is separating pain from chronic pain and then separating chronic pain from chronic musculoskeletal pain.
Okay.
You don't have to talk, like when I talk about it, I don't talk about musculoskeletal oftentimes, but I will in very specific circles. And the reason for that is we don't want people calling us who should be going to a physical therapist. Yeah. We don't want people calling us who should be going to a medical doctor. And we don't want people calling us who should be in an orthopedist's office. We want people calling us for whom those things are obviously not a fit. And chronic pain gives people the opportunity to appropriately raise their hands without me fearing, I'm going to be referring this person to a doctor 80% of the time like it was when I talked about pain in the past.
What's the difference for the people who aren't sure?
So there's acute pain, which is this just happened. Like I fell down and I'm acutely in pain from the fall I just had. Then there's pain, which there isn't really a clear differentiation between acute and pain, but I'll make one for people. It's 1 minute to 3 months. So if you're in pain for less than 3 months, you're in pain, not in chronic pain. Once you pass the 3-month threshold, it's considered chronic pain. Chronic pain is often pain that lasts after the physical injury that led to the pain is gone. Meaning you rolled your ankle and you stretched some ligaments, but they've healed. But your ankle still hurts. Nothing comes up on MRI. Nothing's wrong. It's in your head, they'll tell you. You have back pain from that thing that happened in high school. You know the thing that happened in high school. Bro, you're 55. The thing that happened in high school is no longer the reason you're in back pain. It might have been the thing that started it, but you had several off-ramps, and for whatever reason, of no fault of your own necessarily, you didn't take them. Chronic pain usually means someone has been to a medical provider and that solution has failed them just by the nature of the duration. It's not that chronic pain requires you having been to a medical provider, but most people who are in it have been.
And I'm imagining with those interventions, they might have helped for a term. They might have felt good in the beginning, or they might have helped in the beginning. Would that still fall in chronic pain?
Yeah, so a lot of chronic pain is recurrent, meaning someone will go get physical therapy for back pain as a for example. Their back pain feels better. They return to their life. A year later, their back pain comes back, and they decide not to go to the physical therapist this time, and now it's 3 or 4 months, and they still have it. Or they do go to the physical therapist. The physical therapist resolves it. They stop going. It comes back. Recurrent pain like that can be considered chronic pain, and it's an indication that it wasn't fully resolved. Even if the physical part of it was, which we'll get to, I know, it wasn't.
I see that a lot more when I'm having conversations with people on like injections, like a cortisone, a steroid, things like that, where look, it felt really good for 3 months, 6 months, or even a gel injection, 3 months, 6 months, but it's starting to come back, or it has come back. And I'm thinking about getting the next one, the next injection.
Well, we can talk about those. So things like a cortisone, let's keep cortisone on its own for a moment. Cortisone is a steroid injection. It's meant to radically reduce inflammation, to simultaneously reduce discomfort, to give you a window of time in which you can do the therapeutic exercises necessary that would otherwise potentially be too painful. That's the goal. Oftentimes people are given a cortisone shot and told that should resolve it. Look, in some cases it does, right? If you had a traumatic injury and you were overinflamed, a cortisone shot can reduce that inflammation and your body won't need to re-inflame after. That could reduce your problem 100%. Most of the time, that's not why cortisone is being injected. Then you have other shots like a lidocaine. A lidocaine shot is a non-steroidal numbing agent. It's an analgesic. It's just meant to make you be, same thing, minus the steroids, right? Then we move into things like peptides, like a BPC 157. That is meant to be a regenerative injection. The idea of that is we are injecting a peptide into your system that is going to regenerate the damaged tissue faster than it would regenerate on your own. And the regeneration of that tissue is going to create a reduction in symptoms long term. Sometimes that works. Sometimes you get the peptide shot, function gets restored, pain doesn't change. Then we have things like Synvisc, or like a lubricant injection that you were talking about, like a gel shot, right? Synvisc typically goes into the knee. Those kinds of shots are meant to create physical barriers between two bones that are typically experiencing some arthritis. So those two bones are too close to each other. The padding between them has been worn away. This functions as makeshift padding between the bones. I'm oversimplifying, but that's what it does. That lasts until your body processes it and it's gone. Then you need it again. Anything we missed there?
No, I don't think so.
Okay. I mean, there's oral anti-inflammatories, and same as the injectable anti-inflammatories. It's going to last for a very limited period of time.
Right.
And those are systemic. So you run the risk of being on something that's reducing inflammation in a place that you want and need it.
Right. Because inflammation isn't inherently bad.
Inflammation is inherently good.
Right.
Too much for too long is the problem.
Yeah. So we see that more often with the people in the chronic pain realm, is they are often dealing with chronic inflammation as well.
They can be. That's one element of it.
Got it. Okay. Well, you had given some statistics.
Not
right?
on air.
Not on air?
Did I talk about them on this podcast?
Not yet.
Right. Okay.
We had started to talk about them before, and
This is the air I'm talking about.
This is the air.
This is the air.
The air. I'm interested to hear from you, because especially if they haven't been recorded yet, not on podcast, these stats were pretty astounding the first time that I heard them. So why don't you run through them? This is the problem, right? A piece of the problem.
I'll tell you what. One of the things I'm learning from going back and studying people I admire is they just repeat the same thing over and over and over again. And we've talked about this in the past.
At length.
But I mentored with Jesse Itzler back in 2018. I spent some time at his house. He was telling stories back then and giving advice back then that right now he's on the biggest podcast in the world, telling the same stories and giving the same advice. There's nothing different from 2018 to today. And that is not in any way, shape, or form to minimize what he's doing. It's to emphasize the value of repetition. So here's some statistics for you that I think should send bells off for anybody, especially if you're a fitness coach listening to this, because it's an opportunity where there's chaos and problems. There's an opportunity to solve them and to make money doing it, regardless of how that makes you feel to hear, right? Nobody wants free help. Not if they're going to see it all the way through.
Right.
So more than 20% of Americans are dealing with chronic pain every single day. What's interesting about that is I don't care where you live. If you're in a developed country that's tracking chronic pain, the number is about 20%. And it hasn't changed since they started tracking it. So, what's that?
Fascinating.
It's a consistent problem. Of the 20% of people, that's 55 million Americans, because we're talking about adults. Of the 55 million, 38% of them have depression as a result of the chronic pain. 44% of them have anxiety as a result of the chronic pain. Chronic pain costs the United States more money in healthcare services and wage loss than cancer, diabetes, or heart disease at more than $600 billion a year. Despite all of that, National Institute of Health has, I believe, a $48 billion annual budget. 1.25% of that money is spent on the research of chronic pain.
Wow.
So the biggest financial problem, 20% of the country deals with it. It's the number one leading cause of early retirement that's forced and disability from work as a result of over 300 million people, that might be a worldwide number, 30% of them being a result of arthritis. And NIH dedicates 1.25% of its money to researching the causes and solutions for chronic pain. There are 194 medical schools in the United States. Of the 194, 5 of them have curriculum dedicated to resolving chronic pain in populations who will present to their doctor with it. The other 189 present with purely biomedical solutions, which means they're looking at the what. What is the damaged tissue and what is the intervention to repair that tissue? Shots, medications, surgeries. That's what they learn in their medical schools. Now we can look at, well, what about physical therapy schools? It's similar. Physical therapy schools doesn't track statistically the same way that medical schools do the biopsychosocial model as an injection into their curriculum. But anybody, I can ask you a very simple question. You've been to a physical therapist before. How many people listening to this have been to a physical therapist who asked them questions like, how's your sleep? What are you stressed about? What are you doing to resolve those problems? What does your diet look like? Have you had any issues in the last year and a half that were unrelated to this that you haven't been able to resolve? The answer is rarely. And if you're a physical therapist listening to this and your thought process is, I do that, great. You're good at your job. I'm not throwing stones at you or frankly anybody else. What I'm identifying is physical therapy, generally speaking, as a rule of thumb, just like fitness professionals, are much better at solving physical problems than they are at solving problems that include physical, mental, and social components of them, like chronic pain does.
Is it that those institutions or that institution specifically is better at solving the acute pain rather than the chronic pain? Is that the way it's designed?
It's not necessarily the way that it's designed, but it is a key differentiating factor for a physical therapist that a fitness professional should stay far, far, far away from. So if you got surgery and you need rehab from that surgery, you want a physical therapist.
Yep.
Period. End of story. If you went to an orthopedist and got evaluated for surgery but don't need it, and it's that, like, it's on the, you want a physical therapist. If you hurt yourself 4 weeks ago, 5 weeks ago, you let the inflammation go away and you still feel weak, you still feel pain, you want a physical therapist. If you have numbness or tingling or things of that nature and you're non-surgical, you want a physical therapist. These are things trainers and fitness professionals should not be touching.
Right.
So physical therapists can and do jump into the chronic pain conversation also. But what I have found in the years of serving the population of people who deal with chronic pain is there's a lot more that goes into resolving it than the purely physical methods that were taught in chiropractic, physical therapy, and medical school to solve for the problem. There is a very significant lift of the social and the emotional that doesn't get taught in those schools, that frankly doesn't really get taught anywhere except in the mental health circles. And so it's rare that someone's going to go find somebody who can do all of that for them. And it just doesn't pay for a physical therapist to spend that kind of time or energy. It doesn't pay for a medical doctor, a chiropractor, or an orthopedist. It does not pay financially to do that.
Okay. That's helpful. It's a little bit the structure of the system.
Yeah.
It's a little bit the scope of either the physical therapist, the medical doctor, the fitness professional. It's a combination of many factors, and it's not just one thing.
Yeah, and frankly, the system would work if we weren't an overly sick society. The system isn't as broken as people would like to believe that it is. Health insurance companies make less than 2% profit on an annual basis. 2%. Now, yeah, that's $25 billion. It's a lot of fucking money. Yeah. But it's 2% of what they generate. The advantage that they have is that they have government support that they won't lose money, because we need that system to continue to operate. God forbid something should really go wrong. And I don't want to dive all the way down the rabbit hole today of where the insurance companies came from, but I'll give people a very, very brief dive so that you can understand that they're not as broken as you think that they are. It's just that we're so sick and we're looking for, how are you going to save me, to somebody else instead of ourselves. Health insurance companies started as a way that companies would be able to offer jobs to people without being able to increase their wages. They were able to give them health insurance, and it was not considered taxable income. That's where it started. It wasn't like a big thing that people used for all the stuff. Mm-hmm. It was for emergency use. That was it. Your company would pay for it. Then your company was like, we shouldn't pay for this. We should create a model that allows for it to happen. And it wasn't until the 60s that health insurance started to become what it is today. And we are sicker than we've ever been now. We're fat. We're dealing with chronic diseases, metabolic diseases. We have the same physical pain that we've had since the beginning of time, that no one has changed. And we're going to the health insurance system and saying, why won't you pay for this? Mm-hmm. We were never built to do that, is what they're responding.
Yeah. Well, it's not meant to be a coverall.
Right. So your health insurance will pay for the physical therapy that you need after the surgery that you allegedly needed. Mm-hmm. They'll pay for the surgery that you need. Now, these are, of course, most of the times. And orthopedic stuff is less covered than metabolic stuff because they're not concerned about risk of dying, just suffering, right? Which I get it. That's callous. But that's the reality that we live in. And so if you were starting a physical therapy school or a physician assistant school or a medical school, you want to be able to speak to the potential students who are going to come to you about the kind of career they're going to be able to have when they leave. If 90+% of them are going to be billing insurance as a modality of payment, you're not going to be teaching a lot of the stuff that the insurance companies don't pay for.
Right.
It doesn't make sense for anybody. So we need to look outside of the medical model for resolution of problems that insurance doesn't incentivize doctors to learn how to solve for.
Okay. So we're starting to go down some of the institutional concerns. This is helpful. So all of this stuff is starting to paint the picture of why we're where we are right now.
It's part of it. You know, there's a lot. Yeah. There's a lot.
Right. We won't cover all of it in this episode, but we'll do more.
Okay.
One of the things we've started to circle around and we haven't really talked about yet is that there are solutions that are being presented and they're inadequate. Mm-hmm. They're inadequate solutions, whether it be from the fitness side or the medical side. Mm-hmm. We can stay, for the context of this piece of the conversation, let's stay in the fitness side.
Sure.
Because we did a good job unpacking the medical side. But one of the things that we hear in the fitness space is if it hurts, don't do it. Right?
If it hurts, we can work around it.
Work around it.
The medical space is if it hurts, don't do it.
Okay. So it's the work around it. It's the modify around it. It's the It's, yeah, we don't need to do that today. Let's find the substitute, the alternative. Mm-hmm. What's wrong with that?
Well, the same people who would tell you movement is medicine are the people who are telling you if it hurts, we'll work around it. Mm. And so it's not that any, I want to avoid negations. The fitness industry simply is ill prepared to help people in chronic pain overcome it. That's it. Period. There is no education on it that is specifically designed for fitness professionals. The closest thing to it outside of what we're doing at Active Life, shameless plug, is like a NASM CES, which is a 12-week long course that's done at your own pace. That it's like the table of contents to our program. And it's all physical. Chronic pain is more than purely physical. It has physical components, sure, but it also has psychological components and it has social components. It's not uncommon to hear, if you want to be a millionaire, make friends with 5 millionaires and you'll become the 6th. Mm-hmm. But nobody ever says, if you want to get out of chronic pain, find 5 people who would never tolerate being in it and you'll become the 6th who gets out of it. It's the same thing. And if we take it a step further, there's a misunderstanding of what chronic pain does to somebody's life. The person who's dealing with chronic pain oftentimes has a misunderstanding of what the signals their body is sending them are. So they learn how to be afraid of things that they're feeling. They associate that fear with pain. And then every time that they feel that thing, they get scared and they're in pain. Mm-hmm. That's the cycle. You can't help somebody overcome that by avoiding it. It doesn't work that way. I'm afraid of heights. Well, you'll overcome that fear of heights by just never getting in an airplane or going in an elevator. Said nobody, ever. Mm-hmm. But when you try to take somebody who's afraid of heights into an airplane, there's a significant conversation that needs to happen before they go. And the fitness industry is not taught how to do that. That conversation is not taught. So it's reasonable that people who are in chronic pain are going to stay in chronic pain, that the number is going to stay consistent because the medical institution is not incentivized to resolve it. The fitness industry isn't taught to resolve it. Where are they supposed to go?
So what's the introduction to that conversation look like then? You were mentioning the conversation is not being had because they're not taught how to do it.
Yeah, so let's take the analogy of heights out of it and just go right to pain. It hurts when I do X. That's interesting. What do you mean by it hurts? What does that make you think? Oh, it makes you think it might be getting worse. Oh, why do you think, why does feeling that make you think it's getting worse? Oh, you learned that. Somebody taught you that? Who taught you that? Oh, a doctor, friends, experience. Okay. Have you ever learned anything that you decided actually wasn't true? Yeah. Like what? Santa Claus is real? Okay. Is it possible that you've also learned this in a way that's not beneficial to what you want? I guess it's possible. May I offer you a different way to think about what you're feeling? Sure. Now that conversation might not happen in one visit.
Right.
That could be a 20 visit conversation. But the fitness industry isn't taught long, slow is short and fast. Mm-hmm. It's taught like this will be fast. This will be easy. It doesn't get easier. You just get better. All of those things, which don't actually resolve that issue.
Mm-hmm. Do we think in terms, often in the fitness space, in terms of hours and days and weeks instead of months and years?
Yeah, and unfortunately, the fitness industry is plagued with people who aren't making enough money. And it's their responsibility, but it's not their fault. And what I mean when I say that is it's taught, like it's celebrated in fitness. I don't do this for the money. You think I do this for the money? What do you think? I'm some kind of doctor?
Right. It's my passion.
Right. Okay. I want you to make a lot of money and I want you to feel good about it. And if people paid you a lot of money and you gave them more than what they paid for, they would feel good about it. And as a result of people not experiencing that often enough, the thought process is, how little can I charge this person and still give them the results that they want? And that leads to thought processes that are not comprehensive enough to actually resolve the issues. It's why you end up making recommendations to people between 50 and 60 training sessions before we even revisit what comes next at Active Life. This is a long horizon line.
Right. There were one thing you said early on. I want to get clarity from you on what the difference is. So fitness says work around it. Medical says if it hurts, don't do it. What's the difference?
The difference is medical is trying to protect you in all ways. So the doctor is trying to make sure that you are safe, period. The doctor's job is you don't die. The trainer's job is you live the best you can. I'm obviously oversimplifying for both, right? So doctors, don't come at me with your nonsense about we don't do that. Fine. Okay. But the doctor's job, generally speaking, is to make sure that you don't die. When I say doctor, I mean physical therapist too. I mean orthopedist also. You don't die or become debilitated. The trainer's job, the fitness person's job, is you live the best you possibly can, even with your condition. Okay. But their condition is chronic pain and they don't want it. So it's not about how do I live with this. It's about how do I get rid of this. The trainer or the fitness professional is avoiding it. It hurts when you rotate. We won't rotate. You're not going to stop having pain when you rotate if you don't rotate. So the real question should be, how much rotation and discomfort is appropriate for this person to experience? When do we progress that? When do we regress that? How often are we measuring it? Those are the questions that need to get asked. And I'm glad people who are in the fitness industry are not doing that without proper training, because it's a very thin line between really helpful and really dangerous.
Yeah. And
I think that there's a lot of people who think that they are doing it, and I'm grateful that they're actually not. Hey, it's Dr. Sean here, reminding you that if you are a coach who wants to fill the gap neglected by fitness and healthcare, and you want to make a career doing it, we might be able to help you. Head to the show notes. There's a link there. You're going to click that link to download the ALP curriculum. That's the stuff that we teach to coaches over the course of 13 months to turn them into world-class professionals who never have to worry about missing a paycheck again, doing work they love to do. Go ahead and check that out, and I'll see you on the other side. Let's get you back to the show.
What's the better solution then?
For what?
For helping people get out of chronic pain, because I can imagine somebody's listening to this and who might even be in chronic pain.
So are you asking what's the better solution for the pro or for the client?
It's all the same thing.
You have to dedicate yourself to it. You have to overwhelm it.
As a client and as a professional.
Either way, like, you don't also get people out of chronic pain. If you're a trainer, you don't also get people out of chronic pain. You work with people who are in chronic pain, period. That's your ideal client. You also may have some people who come to you for sports performance. You may also have some people who come to you because they want to lose some weight, but they represent the 20%. The 80% is people who are in chronic pain and want to be out of it. You have to be there. If you're the person who's in, by the way, the reason you have to be there is if you're not good enough to do the job. You're not spending enough time in it. You're not seeing enough. You're not hearing enough. You're not asking enough questions. It's an impossibility. You're not doing it enough to be great at it.
So what you're describing is specializing.
Yeah. Yeah. We need generalists and we need specialists. And helping people get out of chronic pain is a specialty. It requires a very specific set of skills that a regular person, a regular trainer, a sports performance trainer, a CrossFit trainer, a aesthetics trainer, a weight loss trainer, they don't know the skill set.
It's fascinating because those are all specialties as well.
Mm-hmm.
This is saying,
but I would say that very rarely do we find people who acknowledge such. And those are the people who are actually getting the notoriety, the financial freedom, all of the things that everybody else wants. They get it because they say, I'm actually not so good at helping the other person.
Mm-hmm.
But we somehow as an industry have come to believe, no. This is the panacea. Fitness cures all. And that's true, right? It's true. And food nourishes all. But you need a different number of calories for maintenance than I do. And that person needs a different number of calories to lose weight than I do or than that person does. And the way that that person thinks about food is totally disordered. You can't simply be a calculator and solve all of those problems for all of those people by doing the same thing.
right.
So fitness, I believe, would be well served to start to create very clear specialization. And there will be plenty of need and high value on great generalists.
You know, as you were talking about that, the analogy that came up for me is it's very similar to medicine in the sense that the right medicine can be great for almost every person. It's the dosage that either becomes based on the individual, that either becomes the poison or the cure.
Yep. And when we look at medicine, it has swung too far in the specialty perspective.
Okay.
Right? Casey Means talks about this a lot when she goes on podcasts and everywhere, right? She was an ear, nose, and throat surgeon. So she never learned about where are these problems coming from. Oh, you're stressed? Oh, you're eating that? It's like, no. See a problem, cut it out, or sew it up. That was her job. You can become like a testicular cancer urology surgeon, like whatever. It's so narrow. And people get excellent at the physical remediation of the problem that they run into, but they've lost the forest for the tree that they're staring at in medicine oftentimes. And we need great generalists back. And I think fitness just is under-specialized. There is a sweet spot.
Got it. Okay. So back to the solution. We've done a good job of identifying some of the holes in the current process and the solution. What's like to shift the focus, right? It seems like what you're describing is the solution right now focuses on the what. The what the problem is. You're proposing a different...
Yeah, we got to evaluate the why. We all agree the problem is there. We all agree that person has shoulder pain. We do. Why hasn't it gotten better? Well, if you ask 20 different people, they're going to give you 21 different answers. So why is that happening? Well, I think that we need to consider more than simply it's a shoulder. It might be this structure. Fitness professionals can't diagnose anyway. So it doesn't matter which structure. We have to evaluate why is it still there. And most of the fitness industry, most of the medical industry looks at that from what's the tissue, what's the damage, what's the exercise, the rest, or whatever the protocol we need. We need to start looking at all of the stressors, all of the loads that are placed upon the system that lead to a likelihood or a lack thereof that is going to get better. So if you're not sleeping at night, you're unlikely to heal the way that you're supposed to heal. Great. Well, then let's just throw some sleep hygiene at this person, make sure they're off blue light. Well, no. Why aren't they sleeping? Well, okay. They're stressed at work. They got a deadline that they're supposed to hit. Okay. So how are we going to help them better serve their work so that they can sleep, so that they can heal, so that we can put the exercises that they need in place without doing further damage. If you want to help somebody overcome their chronic pain, you have to be able to go all the way back to that root. And in the person's case we just described, it's stress from work. Okay. I have to be able to help that person with their stress from work because they have to be able to sleep and they have to be able to exercise. But exercise today is the wrong thing. So either I'm having conversations with them about work and getting them to make progress while giving them exercises that they think are beneficial for their shoulder, but actually are just beneficial for their overall health while avoiding the shoulder like a regular fitness pro would, until we get them to the point that, okay, now inputs to the shoulder will be met with the appropriate recovery because stress is resolved, sleep is happening, the body can heal.
What you're describing there, which I found very, very interesting, because as soon as you started to go into, all right, so what coaches and professionals will sometimes do is they'll be like, let's just throw sleep hygiene, let's throw the habit at, let's throw the tactic at it. The question that comes up for me there is, okay, I'm the trainer, I'm the coach listening to this episode. I don't know how to go deeper, how I'm going to talk to the CEO of this company who I'm working with one-on-one about how the stress that he's going through at work is affecting his ability to recover here. Like, I don't know how I'm going to bridge that gap with him and help him now overcome the stress at work. Like, I've never done that before. What are you talking about?
I appreciate your honesty. Do you want to? There's a line between, we don't have to go there because unless if you want to know, because the common question that comes up there is, so now I'm a therapist or now I'm a life coach?
Right.
No, we're not talking about the childhood traumas that led to him consistently responding to his secretary that way. And like, that's not where it's going. The reality is most people, the overwhelming majority of people, are actually the best people to solve their own problems when prompted with the right questions. So your job is not to actually solve the problem. It's to be genuinely curious. And if you can learn how to be genuinely curious in a productive way, where you're not just like interviewing because you want to know the answers, you can guide somebody to solving their own issues. There's a great story about Warren Buffett where he invested in a company and the woman whose company he invested in was interviewed and they said, what's the most valuable thing Warren Buffett's ever taught you? And she laughed and they're like, what's so funny? And she's like, Warren Buffett describes himself as a baboon eating a banana. And they're like, what do you mean? She goes, I bring him my problems. And he says, that's interesting. What do you want to do about that? And I solve them. He might as well be a baboon eating a banana. It just so happens he's Warren Buffett. Sometimes you got to just be a baboon eating a banana and give your clients the information about like, when you're doing this, we'll be able to do this. Give them the carrot, the reason to do it. Now, I forget who I heard say it. I wish I could quote them. But what we often do in fitness, let me say that again. What we often do in fitness is we give people more to solve for their problem. Oh, you have shoulder pain? Let's just give you some corrective exercises. More. Oh, your back's hurting? Corrective exercises. More. Okay, great. If I gave you a cup of water and I pissed in it, you want to drink it?
No.
What if I just added more water? There's less piss. Want to drink it now?
No.
Okay. We can't just pour more water into the cup and assume that the piss is gone.
So that speaks to the tactics that you were bringing up earlier around the sleep hygiene and trying to add in the, all right, 90 minutes before bed, stop looking at the screen, get the red light.
Yes.
Like, got it.
Those are, look, all of those things have value. How much? I don't know. If you're already 95% of the way there, sure, start adding those things in.
It's not where you start.
No,
That's what you're saying. It's not taking the piss out of the cup, as you would say.
Exactly. And it's intuitive when you really think about it. We all know somebody who's an abject disaster. And they tell you every time they see, oh, I'm on this new diet. I got this new workout program. This is the one, man. I hired this new mentor. Oh, it's sick. Got this new program. Oh, you're like, dude, you're a fucking mess. None of us are one corrective exercise away from solving our problem. Just like that person is not one mentor or one decision or one exercise away from solving theirs. But we like to think like, ooh, I can fix that. We don't fix anything.
I like that. Yeah, I've said this on this podcast before, and I'm an advocate of therapy. I think that is a great route for people to go. One of the things that people often get into, and the coaches and trainers that I talk to often get into, is, okay, where's the line for me? Where do I draw the line between I want to be able to help this person and helping them resolve the things that happened to them that got them here? And for me, that's it. It's that right there. Anytime that you're looking back and you're looking to the root cause of the thing and you're trying to create the intervention, you're trying to create the solution, the understanding, that's where it's probably not inside your scope anymore as a coach and as a trainer and as a professional.
I think it's important that you define where that root cause is of that behavior, because otherwise I'm concerned that coaches will think, for example, what we did with Jill when she came out, where we talked about like, okay, well, you can't take 10,000 steps before 7 a.m.
Right.
It doesn't work for your body. Well, how am I going to do that? I have clients all day. Well, why do you have clients all day? Well, because that's what my business needs. Is that what your business needs? I think it is. Well, it's not what your body or your psyche need. So you need to be able to break that 10,000 steps up into at least 3 to 4 different bouts. How are you going to rearrange your day so that you can do that?
Okay. So what the difference is to me is that's looking at where we're at right now and crafting the path forward.
Okay.
What the other thing does is look back and ask, why are we here? How did I get here? What needs to happen? What sort of self-love, self-healing? What things do I need to go back and give myself a hug for? What things do I need to forgive myself for? What needs do I forgive everybody else? It's looking backwards versus looking forward.
Okay.
I think our job as coaches, trainers, and professionals is to help people look forward and to craft the solutions moving forward.
That makes sense.
When you're starting to go backwards, that's where you want to be intentional, especially around trying to help them understand why the thing is happening. Now, I've done, the unlifted stuff, the story work, where we'll look back sometimes. I'm not interpreting any of the information that we look back upon. I'm doing what you're describing. I'm asking questions that help you decide what looking back means. That's the difference.
I got you.
So we create the better solution is understanding the why, right? The biopsychosocial model that you've been unpacking here. What would be some things that the fitness professional who's listening to this, I've got some questions that come up for me that they might be thinking about. Okay. So the first one is, and I get this from clients all the time who call, it's often one of the first questions that they ask is, why does insurance cover this?
No, it doesn't.
Why?
Because great question. Because it's not what insurance was designed to help you solve. Insurance as a model, we have to go all the way back to the very beginning. And I hesitate to do that because it could be a 4-hour podcast about the insurance industry. The long story short is that insurance inherently was meant to be what catastrophic care insurance is today. That's the simplest way to describe it. The health insurance industry was always supposed to be what the catastrophic care arm of health insurance is today. Our medical systems evolved so fast and like, if you have an acute care issue, you want to be in an American hospital. We have the best acute care in the world. There are a lot of things that, frankly, we would not have gone to the doctor for before because there weren't interventions for them, or it was just too inconvenient, that we now go for. And health insurance has expanded to start covering those things because the government forces it to. The flip side of that is they've only been pushed so far. And so they're not going to support chronic issues, musculoskeletal pain that affects lifestyle and not life.
Okay. That's helpful. Where the coach, the trainer, the professional listening to this, how do they communicate better around their scope in this chronic pain conversation?
Well, if you're not if you haven't intentionally dedicated yourself for 6 months or more, I'm making that number up, to the resolution of chronic pain for people who've been dealing with it, everything about chronic pain, except avoiding it, is outside of your scope. It's inside of your legal scope, but you don't know what you're doing. And so just don't make any promises about it. For the person who has dedicated themselves, whether through our program or something else that they've done, the scope ends with diagnosis. You are not allowed to diagnose. You can't say this is what your problem is coming from. You can't treat, which means that the interventions that you use cannot be specifically guided to solve a problem in a therapeutic manner. So a simple way to think about that is if we tell a client, oh, you're putting more load on your back than you want to be because you're in extension posture, yada, 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 yada. If we told them, so we're going to create a different posture for you through strengthening these muscles, but you're going to pull you forward, blah, 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 blah. Great line. If we started saying things like your rectus abdominis are weak, and so we need to strengthen them, your hip flexors are actually too strong, so they're forcing your pelvis forward because they're pulling down. So we got to loosen those up. Those kinds of diagnosis and specific solutions are out of scope for a fitness pro. Any manual therapy, out of scope for a fitness pro. Keep your fucking hands off of your clients.
Does this include helping them stretch?
It doesn't include helping them stretch unless the stretch is meant for a specific therapeutic value.
Got it.
But you are not to manipulate tissue. Period.
Right.
Like you can't massage. You can't Graston. You can't pin and stretch. Like just no. No.
Okay. All right. That's helpful to start to piece together the scope piece. What else should there's one piece in there that I'm a little opaque on still. All right. So the diagnosis piece, we create functional diagnosis.
We made that term up. We're allowed to do a functional diagnosis. A functional diagnosis it sounds good. A functional diagnosis is just, oh, you're really strong at this and you're really weak at this. Your flexibility is great here. It's a little bit limited over here. You rotate well to the left, but not so well to the right. They're big, broad, obvious things that we find in people, but with the way that we're able to describe it to a client, it's something that they can hold. Oh, my list of problems are these, none of which are medical. Okay. A medical diagnosis is you tore this muscle, you have a herniated disc at this location, nerve impingement, like the sciatica. These are diagnoses.
Okay. So we're looking bigger picture rather than in terms of our flexibility, mobility, strength, balance, skill, recovery and capacity, breath work. That's the filter by which we're creating that functional diagnosis through.
Correct.
That keeps us within our scope because we're not looking at a single musculature and being like, we're going to do X, Y, and Z to resolve that.
That's right.
Okay. That's helpful. What else are the coaches who are thinking about this realm? What do they need to know?
That they have a tremendous opportunity should they choose to take it. The reality is where there's chaos and where there are problems, there are really valuable, lucrative solutions. And you don't have to like that for it to be true. But people who are in chronic pain would be more than happy to pay you well to help them get out of it. No one else is talking to them because no one else understands them. Even if people think they're talking to them. This is what I find so interesting. There are trainers who will say outwardly, like, I help people who are in pain, chronic pain, all this stuff. And then the language that they use after that, the how, indicates with extreme clarity to the person in pain, you have no idea what you're talking about. And so...
Do you have an example of that?
Yeah. Without selling anybody out. Okay. If you can say something like, I've been training people in pain for 20 years, And what I find is that working out is the best solution. Movement is medicine. Just get in here and start moving. And over time, you're going to feel better. Your pain is going to be gone. That sounds great. You can follow that up with something like, I see this with all of my clients. That also sounds great. But here are the problems with it. The person in chronic pain often feels like they're alone. So they don't think they're anything like all of your clients. But you didn't know that because you didn't study people in chronic pain. Another thing is they've been exercising. Oftentimes they've been moving. They've been doing the things that you're suggesting you're going to do, and it hasn't worked. So they're able to discount you very quickly. Number 3 is they see you working with other populations, and they've already been to people who specialize in what they're telling them is wrong. And those people haven't been able to solve for them. Now they're going to come to you, the person who helps Jane lose 50 pounds, Mark jump higher, and Steve get abs for summer. You're the one. They see the age of the clients who you work with are generally in their 20s and 30s, even if they're in their 40s. They see that you do things in a group. And they're like, no, I'm very specific. That ain't going to do it. They see the implements that you use before they are ready to see the implements that you use. And so they're afraid that what you're going to do might make them worse. It's not worth the risk. All of these things and so much more, but you have no idea. So when you learn how to speak to people who are in chronic pain, you also know how to help them. But the indication that you don't know how to speak to them is the indication that you don't know how to help them.
Okay. Last question that's coming up for me. Well, last 2 questions. Number 1, we've talked a lot about the chronic pain. What if I've listened to almost an hour of this podcast so far and I don't want to help people in chronic pain?
Don't.
That simple.
Yeah, don't. No one's telling you you have to do anything. You can make a lot of money doing work that you love to do and have nothing to do with people in chronic pain. I prefer that you didn't if you weren't inspired to do it. It's a labor of love, man. You have to make a money in your labor of love to be happy at your work, no matter what you do. If you want to help people get out of chronic pain, you love when they come in feeling like there's nothing that's going to help them and giving you one shot. Like, you're my last shot. For most people, that's nerve-wracking. That's, it's that. Or even worse, it's awesome. I'm going to fix you. If you feel, I'm so happy that you finally found me, you're in the right place.
The whole I'm going to fix you thing always just irks me.
It's a natural progression for people to go through. It's, I can fix your shoulder. I can fix your back. And you're broken because that's broken. But they're not broken. And so you can't fix them. And you are only the guide who's going to help them decide to do what you believe they should do for their shoulder or for their back. And so ultimately, you're not fixing that either. They are. It would be akin to Cisco, the food delivery company.
I thought you meant the thong song.
I know you did. That's why I gave you some help.
Appreciate it.
Believing that you can fix somebody because you write a great exercise program would be like these big food distribution companies believing that they're Michelin star chefs because they drop the ingredients off.
Oh, that's fascinating. That's pretty good.
What are you talking about?
Yeah.
You couldn't cook for shit.
Right. I like that. Okay. What else? What should we wrap on?
What should we wrap on is a better question than what else.
Yeah. What should we wrap on?
I believe, and I strongly believe this, more so now than ever as I've been talking about it in this way, that chronic pain is a problem that is ripe for disruption. It's ripe for disruption. Everybody knows somebody who's in it or is somebody who's in it. Everybody who's in it, with rare exceptions, wants it gone. And there is nobody solving for it consistently. It's ripe for interruption. And we're the ones who are going to lead the way.
To your point, that segment of the population seems to be growing. It is growing.
Well, statistically, it's not. I mean, there was 1 year of growth up to 24.3%, which was last year. I don't think that will stay there. But the statistic that you're describing, I think, is the number of people who are aware they have the problem and are aware that there is a solution for it.
Yes. And often this coincides with an aging population.
It does, but they die.
Yeah. But we're getting more of that demographic.
Yes. It
taking up a larger segment of the pie.
Well, here's the thing about that. The aging population, when they were young, there weren't gyms. Mm-hmm. Like there were, but they weren't common.
Right.
So now they're looking to this industry and saying, do one of these solve my problem? Maybe one of these solves my problem. And generally they're met with, no.
We can help anybody.
Right. And so there's a massive opportunity to be the person who solves that problem. It's, for me at least, it's gratifying, it's fulfilling, it's lucrative. Like I don't see a downside to it, but that's me. So you have to want to do it too.
Dr. Sean, thank you. This was an insightful episode for me. I imagine the same to be true for everyone who listened.
I hope so. Can I leave people with one little mental image?
Yep.
When you think about our healthcare system, because it's easy to say it's broken. It's easy to say this is their problem that they should be solving. I want you to imagine a trucker. The healthcare system is a trucker. It's the guy driving the truck. That's your insurance, your doctors, all of that. The back of the truck is meant to hold 50,000 pounds. We've already stuffed it with 200,000 pounds of goods. The government came in and said, I get it, your truck is going to break, but we need you to ship this stuff across the country or the country isn't going to work anymore. So the government came in and reinforced it, made sure that truck would never break down. And then we said, hold on, I got to get this on that truck. And now it's 200,001 pounds. And the government needs to reinforce it again. The trucker goes to the government and says, I can't take that unless you reinforce it. So the government reinforces it and the trucker gets paid for every pound of goods that are on the truck. So we're like, how the fuck can you keep getting paid for this? And government, how can you keep giving them money for it? And we keep saying, why won't you take my package? Ultimately, I believe that right now, people aren't going to like hearing this, but we are in the moment where we go back to JFK saying, ask not what your country can do for you, but ask what you can do for your country. And the thing that we can all do is get healthier and need less room on the fucking truck.
It's a powerful image.
Good.
Thank you.
You're welcome.
See you out there.
I hope you enjoyed that episode of the Active Life podcast. If you did, please head to wherever you listen and leave us that 5-star rating. It really does go a long way. 5 stars goes a long way. Please leave them. If you're interested in working with us as a coach, remember, we help coaches from around the world build fulfilling careers, working with clients they're inspired to help so they never have to worry about being able to pay your bills again. No one's ever going to ask you if you are going to get a real job when you work with Active Life. All you have to do, head into the show notes, click the link that you find there, download our curriculum. That will give you a feel for what it is going to take for you to be successful. A team member of ours will reach out to you to find out if it's a fit for us to work together. Till the next show, turn pro.